Hey class, Rebecca here, just doing my weekly check-in for week 8. Just a reminder, my placements at a clinical counseling setting, working with adolescents and adults. I've been doing both populations lately. Um, so far what I have going on this week is still more diagnostic assessments with the adolescents and the kids. I've also been working with open access with the adult side, so I'm getting some adult clients as well. Right now I have 4 people scheduled to do individual sessions with me. So this week my question is kind of what I asked before. Just looking for some techniques on how to work with people in individual therapy. I feel like that's a part that I'm lacking in. I don't feel like I have a lot of clinical tools. I have some, and it also kind of depends on the person. I did an individual session on Friday of last week with a girl that I originally did the intake with, and her therapist was out that week, so I got to work with her with an individual session, and that session went great because we kind of knew each other, and it was easy to talk to her, and it was easy for her to use some CBT tools to kind of combat some of the self-harm behaviors that were coming back for her. What I'm finding more difficult is working with the adult population. The one client that I have right now who's an adult, she is 21, she's pregnant. She doesn't have a job right now, and she can't get hired anywhere because she has a felony. And because she has a felony, she also doesn't qualify for housing assistance. So, and in the week's time that I did her intake and then seen her again, she ended up moving from one place to another. So she's been displaced with housing. She has a felony. She's also in the AOD treatment at our agency. So she has a lot of things going on, and it's just really hard for me to get her to find some hope in her life right now. So I was wondering if anybody had any techniques around empowering clients even when their situation is really in a bad situation and things are really going wrong in their life right now. I also was wondering if anyone ever worked with integrated healthcare. One of the things my supervisor mentioned to me was that integrated healthcare right now is kind of a big deal. So if she was telling me that when I update my resume that I should put something on there about integrated healthcare. I've worked with that a little bit at the agency. When we see clients, we get a release of information for their primary care physicians, just in case anybody needs to exchange records back and forth. So part of my duty before I was doing all the intakes was to call primary care offices and fax these coordinated of care forms. It just gave some information about why we were seeing their client and their diagnosis and any medications that they were taking. So I just was wondering if anybody else's agency was working with integrated healthcare in any way. And really I'm just looking for some advice on clinical tools to use with individual sessions. I feel like I've gotten a lot of good experience, and I know a lot of CBT techniques. I did some training on DBT techniques, but our agency, we really don't have a full team to really employ DBT fully. So I just was wondering if anybody could offer me some clinical tools to use with working with people in individual therapy. Any feedback on that would be helpful. Hope everyone has a great week. Thanks.